everyone. Thank you for joining us for our virtual family orientation session today with the Health Center and the Counseling Center. We're joined by TU staff today who are the experts in their area. So we'll learn a little bit about the Health and Counseling Centers and what they can provide for your student. If you haven't joined us before, my name is Catherine Knaus. I'm the Assistant Director of New Student and Family Programs, and I work primarily with families. So if you need anything during your student's experience at TU, feel free to contact the Office of New Student and Family Programs. And I'll let our student employee introduce herself.
Hi, everyone. My name is Grace. I'm the Student Director of Family Engagement for New Student and Family Programs, and I'm a rising senior and nursing major.
So we're going to have the Health Center and the Counseling Center give an overview of their services, and then we'll open it up to questions. The way that you can submit a question is by using the chat function, which is typically on the bottom of your Zoom screen, and it has a speech bubble. If you type in the chat, I'll get the question and be able to ask it to our presenters for you. So with that being said, I'm going to go ahead and start Allison's presentation. She'll talk a little bit about the Health Center.
All right. Good evening, everyone. Thanks for all of you who are joining us. My name is Allison Rohrbach. I'm the Associate Director here at the University Health Center. Go ahead, Catherine. I'm good. So, at the University Health Center, we like to break our services and what we do here down into three categories. So, primary care, public health, and health education. So primary care would be our first part. Go ahead. So these are the providers that we currently have working for us at the University Health Center. So Dr. Lopez, who is our interim medical director, we're actually in the process of hiring a new medical director. So Dr. Lopez can go back to her functions as a physician. We have a nurse practitioner. We have 3 PAs and another PA who we're actually getting, who we've hired, who will be starting very soon. So these are all people who can see your students for a wide variety of health issues. It's beyond, the nurses, the nurse room in high school and that sort of thing. These are actual medical providers who can see your students. So we'll go through some of that. Some of the services that we provide, so probably the most common things would be things like colds, flus, and sore throats. So students come and see us when they have those kinds of things, common illness and injury. We do physical exams, we do gynecological exams and annual exams for our female students. We do have a lab in our health center. So we have a Quest person who actually, a phlebotomist who can draw students' blood if we need to have any lab services done. We do immunizations here as well. So if any of the immunizations need to be done, they can get those done as well. And then the other one I wanted to mention is massage therapy. So we do have a massage therapist on staff. It's not open to parents and families. It's only open to our students, and they can come in, have massage therapy done. And there is a fee for that. We don't bill health insurances for massage therapy, but that is something that our students really love. And then we just want to be your students' primary care. When they're here at Towson, we know that there are a lot of places nearby, a lot of urgent care centers and that sort of thing, but we can provide all of those types of things here at the health center. So we want your student to use us as their primary care when they're here on campus. So making appointments, we are open Monday through Friday from 8 a.m. to 5 o'clock p.m. There's actually a nurse advice line with the phone number listed here, which is actually the main phone number to the health center. So if it's after hours or it's on the weekend, a student can call this phone number and get advice from a registered nurse who will let them know whether they should immediately go for care or treatment, or whether it's something they can wait to come in and see us for, or give them whatever advice they may need for whatever they have going on. We do appointments online, on the phone, and they can also walk in. The most popular way is to go to our health portal, which is tigerhealth.towson.edu, and that they can make appointments that way. They can also call that main phone number, which is ends in the 2466 during our business hours. And then we do allow walk-ins for some types of appointments. Those would be things that are like kind of easy appointments, like colds and sore throats, pink eye, those kinds of things. We do ask that students make appointments early. You would be maybe surprised, but there are a lot of students who come in at 4:55 when we're closing at 5 o'clock and tell us that they're dying and that they need to be seen immediately. So we try to ask if you're going to walk in to come in earlier in the day. So what to bring? So students need to bring a copy of their insurance card with the policyholder's name on it, as well as their TUID, and I'll go over that a little bit more. You can upload your insurance card to the Tiger Health portal, so I'll go over that as well. And we are a university that does not have a hard waiver, which means that students do not need to opt out of our health insurance plan. So they don't need to go in and opt out of Aetna, but we do have a plan available if students are interested in purchasing it. And they can go to aetnastudenthealth.com, and then on the drop-down menu, pick Towson University, and it will give you all the information about the health insurance that we do provide through the school. We do have a dispensary in the health center. So what that means is that we have some common medications that students can purchase, but it's not the same as a pharmacy. So if a student wants to use their pharmacy plan, there are many pharmacies close by. There's a CVS very close to campus, about 2 blocks up, that a lot of our students use, and there's a lot of shuttle services that can take them to pharmacies if they want to do that. But if they want to purchase something in the health center, they can. It's just they can't use their health insurance, their pharmacy plan. So they would just use their TU1 card for any money or points that they may have on there if they wanted to buy a prescription with us, or things like Mucinex, or types of medications that are over the counter, but they don't want to have to go to a pharmacy or Target or whatever to have to get it. We have a lot of that stuff here. And then privacy, we just want to make sure that parents understand that all medical information for students does remain private. Students are able to grant permission to share medical information episodically. So there's not one blanket form that students can fill out and say, my parents have access to all of my medical records. In emergency situations, or if a student is unable to communicate, so they are unconscious or there was an emergency type situation, the emergency contact would be informed. That's usually done when students register and become admitted to the university. And also on our web portal, there's actually a place where students can put in their emergency contact as well, so that you would be contacted in an emergency situation. Okay, so that's about our primary care. And now public health. So this is where we're going to talk about things like immunizations and those types of things and the requirements we have. So immunization requirements for all students, whether they're living on or off campus, we require proof of 2 MMR vaccines. The first dose has to be after the student's first birthday. The Tdap, which is the tetanus, diphtheria, pertussis, that has to have been after 2005. And then they also have to provide the tuberculosis risk screening questionnaire, and I'll explain how to do all of that. If they're living on campus, we also need information about meningitis. So it is not a requirement, it is highly recommended. So students can either give us that information, or they can sign a waiver saying they understand the risks and that they're not receiving the meningitis vaccine. So all of the immunization requirements are due by August 15th, and there are some penalties if we don't get these immunization requirements in. So the first is that students who do not have all of these immunization requirements in will receive a $50 fine that will be placed on their bursar account. And then they also will have a registration hold put on their account for the spring semester. So we take this very seriously. We need to make sure that students have all of these immunizations in. So you need to make sure you work with your student in getting that information in, and I'm going to show you how to do that. I'm sure you've heard this by now, but there are some COVID-19 vaccine guidelines. So As part of the University System of Maryland requirements, all Towson University students, faculty, and staff on campus this fall must be vaccinated against COVID-19. There are medical and religious exemptions available, but proof of vaccination must be submitted by August 9th, and the email address on here, I'm sorry, the website address on here, towson.edu/vaxverify is where you find all that information, how to upload it, where the exemptions are, all that. And then you can learn more at towson.edu/coronavirus. So how to get us your immunization record. So the first thing you need to do is get those immunization records. So you can either download this form that we have right here, which is on our website, and that is, you could take that to your physician, and the physician could fill out the dose 1 and dose 2 of the MMR, the date for the dose of the Tdap, and then also meningitis information if they're living on campus, and your physician can sign this and date it, and you can upload this form. The other thing you can do is just what I normally do when I need this information for my kids for like camps and things like that, is you just go to your physician's office and say, I need a copy of my child's immunization records. They give you a copy, a printout, and you can upload those in place of this form. And those, if you get those from your doctor's office, we don't need them to be signed. We just need the printout. So it just needs to be legible in English, and you can upload them that way. So the way that you're going to upload them, you're going to go to our website, which is towson.edu/health center, and you're going to click on this black box that says Tiger Health Portal. So you have to scroll down a little bit, but the Tiger Health Portal is where you will log in for students to upload their immunization forms. Okay, so click on that black box. They're going to log in using their TU username and password and click proceed. And then they're going to enter their date of birth and click proceed. And then you're going to see these 2 red links that say that you have 2 forms awaiting completion. So the first is the required immunization history, and the second is the TB exposure risk screening questionnaire. So click on the first one that says immunization history. And then it's going to have the information that needs to be entered. So the date of their first MMR, the date of their second MMR, the date for their Tdap, the date for their meningitis vaccine. So you put all of those in, and then it's going to have where this red arrow is, it says add immunization record. And this is how you're going to upload the immunization record. Oh, so how to upload the immunization record. So I should have had that in there. So you click on add immunization record, and you can upload either that form that you downloaded from our website or the immunization forms from your physician's office. And you can upload those as a PDF, a picture, you know, like a PNG, a GIF, all those different kinds of things. So you can upload them that way. And then you just do add immunization record, and then you will hit submit. Click the red submit button. Then you're going to go to the next one that says tuberculosis exposure risk screening questionnaire. You're going to click on that, and there's going to be some questions that your student needs to answer. So these are basically questions about whether or not your student was born outside of the United States, travels frequently outside of the United States, works in a facility that may have higher risk for tuberculosis. If the answers are no to everything, they would just click no for the questions, and they would hit submit final. If the answers are yes to any of them, one of our staff would be in touch with students about getting further TB testing. And then to upload the insurance card, I talked about this before, so you can take a picture of the front and back of your insurance card and upload that as well into the web portal. And what happens is all of this information then goes into your student's medical record. So we're not dealing with papers, everything is just uploaded and easy for us to see. And then last but not least, we have health education. So we have wonderful staff in health education who are doing lots of programming and outreach about different topics for your students. So go ahead, Catherine. So one of the things that they like to always say is to tell families things that you can pack for your student if they're living on campus. So things like, you know, a thermometer, decongestant, antihistamines, cough medicine, you know, those kinds of things, just so that, you know, acetaminophen and ibuprofen and those types of things, so that if your student, isn't feeling well, they wouldn't have to leave their room. They may have that already, especially when we have things like COVID and other types of, we'll be embarking on flu season. A thermometer is a really good idea because, for fevers and that type of thing. So just a list of some things you could pack. And then just involvement in health education opportunities. Our health educators do a lot of different, peer education programs. So they have different peer educators if your student's involved and wants to get involved in those kinds of things as well. And then questions. So we put three phone numbers up here, and I always tell parents this is like our direct lines. So Yuling Shao is our new director of the health center, and his information is here. My information is the associate director, and then Allison Seeley, who's our assistant director for health education and promotion. These are our main, these are our direct lines. If you have questions, feel free to reach out to us or email us. We are happy to help. And if we can't help, we know the people that we can send you to try to help. And then of course, this is all of our social media. Our health education staff work very hard on all of our social media. So that information is on there as well. So I will be happy to take your questions. I think we're gonna wait, until the end for questions.
I do have two quick questions that
Okay.
I'll pose to you. Actually, one was covered. Is there nearby urgent care? There is, if the nurse advice line says so. And then are asthma treatments available at the health center?
So things like, I'm assuming they're asking about nebulizers. We do do nebulizer treatments for students if they need to come in and have that done. I'm not sure if there's anything additional that they may be thinking about, but if they want to ask that, I'd be happy to give more info.
Great. That covers the questions that have been submitted for now. So if you think of anything else you'd like to ask Allison, feel free to enter it in the chat. And I am going to hand it over to Molly Herman from the Counseling Center.
I just realized I was muted.
Now, yes.
So hello again. This time you can hear me. So hi everybody. My name is Dr. Molly Herman. I'm the interim director and the training director of the Counseling Center here at Towson. I've worked here for 27 years, so I've certainly seen a lot of students over the years, and I'm really excited about this opportunity to let you know the kinds of services that we can provide to your students while they're here at Towson. So let me this ready. Okay, so this picture may look familiar to you. This is a similar picture to what Allison just shared, because we are actually very fortunate to be located in the same building. So the health center is on the first floor and the counseling center is on the second floor. We're kind of a one-stop shop for wellness that way. This is our staff. As you can see, we have a really lovely, diverse group of clinicians and an interdisciplinary staff as well. So we are ready to serve with any variety of whatever needs your student may be bringing to campus. So we actually have been very excited to roll out a brand new clinical services model this past year during the pandemic year. And so this is the first year that we'll be offering it for in-person care. And this has been a direct response to a history of it being kind of hard to get in quickly to be seen here at the Counseling Center because there is such a demand for our services. So we overhauled our entire clinical services model to afford same-day care. Students can call us, and as long as we would strongly encourage you to have your students call us in the morning in order to ensure that they'll be able to get an appointment that day. They can come in and be seen the very same day by a counselor, which is a major shift from what we were offering within the past. And they will have a what we're calling flexible, culturally responsive, solution-focused meeting with a counselor who will kind of really zero in on what that student needs right now and plug them into appropriate resources. So again, we're obviously very proud of the same-day appointments, so they should just call and they can be set up to see a clinician later that day, as long as they call early enough in the day. So what we offer now is also an expanded array of services. So we have a lot of resources online. We've been continuing to build those options because we realize that a lot of students may need to kind of check some things out online before they want to come in, or for some students, that's actually all they need is to just access some of the resources that they can get online. We have a lot of peer support resources. We offer some workshops that are skills-based to help teach students new skills and strategies for better coping. We offer group counseling, the solution-focused same-day appointments, which I just mentioned, and we also offer after-hours crisis support. So just to give you some idea of what kinds of groups we offer, we have psychotherapy process groups, which are just general groups focused on improving relationships, so improving students' communication skills, self-awareness, anything to help improve their relationship skills. And then we offer a bunch of different support groups or theme groups. So we have a group for first-generation college students, an LGBTQIA+ support group, a group for immigrant students. Sister to Sister is a very popular group. It's for a support group for women of color. A new group that we're offering is a support group for student athletes. We're going to offer a transfer student support group, and also we have a group for survivors of sexual assault and relationship violence. And then our workshops, which are more skills-based, we have the Be Your Best Self, mindfulness meditation, Rio, and Accept Yourself. These are really just about helping students learn coping strategies, how to better manage anxiety, how to be present, how to live their lives more fully and manage the inevitable difficulties that come up as they go through their college career. We also have a very vibrant outreach program. So some of our outreach, this is just some sample topics that we have on our outreach menu. So different student groups can request an outreach program. Sometimes student organizations or faculty or other staff members may request an outreach program, and they can choose from these pre-selected menu. This is just a sample, and we've tried to really make it varied enough that it will meet almost anybody's needs. We also have, this was started during the pandemic, but it was so successful that we're planning to continue it now, even when we're all back here in person. We release new videos on Mondays and Wednesdays, Mindful Mondays and Wellness Wednesdays. And these were really popular. Just some different sample topics that those address are how to deal with stress, self-compassion, meditation, managing sleep issues, using social media wisely, mindfully, and managing relationships. So those are wide variety of topics that come out. And this is also something that's new as of this past year. We have 24-hour support now. So if the center is closed and a student is having a psychological emergency, they can just call our main number, just call the counseling center number, and they will be connected immediately with a clinician who can help them provide phone counseling in order to help them manage the crisis. And this is 365 days a year, holidays, 24 hours a day. Another really wonderful resource that we definitely want to make sure you tell your students about is, this is brand new for Towson, is called Together All. So this is an online international platform that's starting to make its way through different colleges in the United States now. Where students have 24-hour access again to a free online platform where they can connect with their peers to just join chat groups and get support from other students. It's really, it's set up so in such a way that they can zero in and identify others who are dealing with some of the same issues they are. They get support, they can get advice, and it's also monitored by professional staff who can identify if there's a student who needs to be reached out to by a professional and get them the more intensive help that they may need if there's some indication that they need that. So we have a lot of trust in how Together All can provide both support and also that backup protection is needed. So this is our webpage. I would encourage you to just explore it yourself, go maybe sit down with your student and look at it together. We have, in addition to information about our services, as I mentioned, there are just a large number of self-help resources. So things that probably you may even find useful yourself. So I really encourage everybody to take a look at our webpage. And then we also are very active on social media. So students can follow us on Instagram, look at our Facebook page, and follow us on Twitter. We do regular postings with psychoeducation, just information and strategies to help live a more balanced life, healthy eating, sleeping, etc. You name it, and we've probably had a post on it. So that is my presentation about the Counseling Center, and I guess we can open now to just any questions there are.
Absolutely. And we'll start with someone submitted a question of, will students receive a card or something that they can have with them or post in their dorm room with the emergency numbers from the counseling and health centers? I don't know if
We
either of
don't
you
have
provide that.
we don't have, I'm trying to think, I mean, we actually do have some magnets that I think we were going to give away at the tables for the orientation next week and the week after that, so students could come by and get a magnet. We don't tend to do a lot of printing of things these days, just because the students don't tend to look to print materials in order to get information. So all they need to do to find those emergency numbers for the Counseling Center, and I'm guessing for the Health Center as well, would just be Google Towson University Counseling Center, and everything they need will be right there available. They can do that from their phone or from their computer.
And that's a great point, Molly. Both the health and the counseling centers will be represented at our in-person orientations if you're registered to attend one of those next week and the week after. I also just want to remind folks that I will ask all these questions to our presenters anonymously. We've heard a lot, so please feel free to ask us anything that is on your mind. In the meantime, while we wait to see if anyone has anything that they'd like to ask, I wonder if, Grace, do you have any tips and tricks how to get the most out of what's provided from the health center and the counseling center?
I would say in general, just definitely, I guess, educate yourself and encourage your students to educate themselves on the resources that are offered. I think that the Health and Counseling Center both have a lot more resources than most students actually realize and know about for the most part. Like all of the different counselings, group and individual, and then everything that the Health Center has to offer. So yeah, I would just say encourage your student to just peruse on the websites, look at all of the services they have to offer. And then also, I guess, educate yourself in case your student comes to you and has a concern, and you can say oh, doesn't the Health and Counseling Center have this? Also, I know that both the Health and Counseling Center, I don't know how things will be this year just because of some COVID precautions, but typically around move-in time, they'll have different events and things. So encourage your students to go to those. But yeah, I would say just use the website and resources as much as possible.
Thank you, Grace. We did have another question come through about the counseling center. Is it easy can a student see the same counselor for a specific concern? And does seeing a counselor go through a healthcare plan or pay as we go?
Well, the good news there is that it's completely covered. There's no fee for the use of our counseling services. So, so you don't have to worry about that. And so with regard to seeing the same counselor, then yes, we actually would encourage that. And since we're doing this drop-in same day services now, it's really the student can make a decision. And if they want to come back, they can ask to see that same counselor and come back at a time that they're available. Certainly if the student is getting any ongoing individual counseling, that would always be with the same counselor.
Thank you. I am not seeing any other questions. I want to make sure to check with Molly and Allison if anyone private messaged you questions that we need to address.
I have not gotten any messages.
Great. Are there any things that you want to make sure families know? I know you covered a lot.
I actually wanted to say, kind of thinking back to our presentation, I don't know if I went over as much about health insurance that families may want to know. So what we do bill health insurances here at the health center. So students would be required to bring their health insurance with them when they come in and see us. We do see students though who are not insured or their plans are not accepted here at the health center. I always tell families the best thing that they can do is to take your health insurance card, flip it over, call the phone number on the back, let them know that your student is going to be coming to Towson University and you want to know if the plan that you currently have will be one that is participating with us here at the health center. So we work with a lot of the major health insurances like the Blue Cross Blue Shield and the CareFirst, United, Aetna. We do bill for medical assistance. So we have a lot of students who are on medical assistance. We bill for TRICARE, which is for our veterans, our veteran families. And there's actually a list on our website that shows all of the plans that we are currently participating with. I will tell you that we don't have this happen a lot, but there are plans that are very specific and unique. So a great example is I remember there's a student whose mom was a teacher in Connecticut, and they had a very specific HMO that was just for their like area and where they lived. And so it was one that wasn't accepted here. So there are, going to be some cases like that. But the other thing I will say is there is always the option to buy the Aetna plan through us, and students can always pay out of pocket, and we can do reduced prices for out-of-pocket services for students who, are underinsured or don't have health insurance.
Thank you, Allison. We always do get a lot of questions about insurance, so I appreciate it. Molly, anything else you want to add?
Just that I know this is a really exciting and frightening time. I've been through it myself as a parent 2 times over. And so I just want to wish you all well and let you know that you've chosen a school that actually is incredibly student-centered, and we are all here to support your student. And again, just to reiterate that looking at the website of the counseling center with your student, maybe in advance, or just telling them to please just take a look at it so they can see the huge variety of services and resources that we offer. It doesn't have to be, people don't necessarily just want to use the counseling center just because they're having some serious depression or anxiety. Those would certainly be reasons to come, but there's lots and lots of other reasons, including just general growth. So wishing you all the best as you navigate this transition. I know that it's a big one. Been there.
Thank you so much. I just want to say thank you again to Molly and Allison for helping us today, to Grace for always being my sidekick. I'm starting to see some familiar names on these calls, so please continue to join us as we finish out our family orientation series this week. Then we'll start seeing some of you who are registered for in-person the week following. If you want to look for more information about families, you can always visit our website at towson.edu/families, and that's where the recording of this session will be posted as well as the links to future sessions. So thanks for joining us tonight. We'll see you later, and go Tigers.